Welcome to Wake Up with Patient Safety. I'm Ashley Digiovanni, and I'm so happy you decided to join us and wake up with us today for my last episode of Patient Safety Podcast. We have guests with us across the company, from frontline associates to top leaders, to talk with us about the overarching focus around patient safety and all the work we do around it. So grab your favorite morning beverage and get comfortable as we dig in. I'm so excited to introduce our guests for today, Anthony Steele, Senior Revenue Cycle Architect with UAE Consulting, and Mathieu Leguet, Localization Analyst with IRL Translation Services. In this interview, we will discuss the impacts of neurodiversity and autism in healthcare and patient safety. Thank you so much for joining us today. This is such an interesting and important topic, and I think a great opportunity for us all to learn more. So to start us off, can you each tell us a little bit about yourselves and what neurodiversity is?
I can start. I'm Mathieu, and I've been at Cerner for over 3 years. Not really long before I started, I realized that autism explained a lot of what could otherwise be referred to as personality quirks, not only for me, but also my siblings, parents, and grandparents, although it's not really a topic that we discuss as a family. So what are we actually talking about? Anything from difficulty reading social cues and making friends, very precise and literal with language, a range of sensory hypersensitivities, intense interests and somewhat atypical hobbies, deep thinking, being extremely knowledge-oriented, inclination towards planning and systemization, and somehow disconnect between thoughts and body. It's called interoception. It's when you struggle to read or interpret what's going on in your own body. So coming back to when I started thinking I was very likely autistic, I started reading a lot about autism, which led me to the neurodiversity movement and learning about the overlap and co-occurrence between all the different neurotypes, such as dyslexia, autism, ADHD, dyspraxia, dyscalculia, dysgraphia, and so on. So for the last 3 years, I've been deepening my understanding of the topic, and now I see that ADHD and dyspraxia also apply to me. And interestingly, my partner was diagnosed with dyslexia when he was in school, and although he was never assessed for ADHD, he exhibits typical traits of hyperactive ADHD. So I've recently been making autistic and ADHD friends through the online community. And in fact, when I think about most of the close friends I have, I can see pretty clear neurodivergent traits. And there's also 2 other traits that are common in autistic people, and they're kind of tricky to articulate, but I've managed eventually to identify them in me, which is difficulty processing and interpreting own emotions. It's called alexithymia, and also struggling to recognize faces, which is called face blindness in vernacular, or prosopagnosia is the technical term. So on one hand, to summarize, those are differences that don't make me any less than someone who is not autistic. It's just a matter of understanding that normality is pretty subjective. But since all those neurotypes, they are minorities, so societal systems and processes tend not to be that inclusive, and it ultimately has a fairly significant impact on access to education, employment, and healthcare.
Yeah. Before I jump in and add any additional tidbits there, Anthony, I'd love for you to introduce yourself, and then I'll add some thoughts.
No worries, Ashley. So yeah, I'm Anthony Steele, based in Dubai, working for Cerner in consulting, in the international consulting space. I'm coming at autism and neurodiversity from a slightly different angle to Mathieu, where I myself would consider myself to be neurotypical. However, I've got a family. I've got three children, 2 of which have been diagnosed on the autism spectrum. It first came to with my youngest boy, my youngest child, boy George. When he was diagnosed with autism as a 2-year-old. He's what we call non-verbal autistic, which is kind of a severe limiting disability for him. He's now 6. He still doesn't talk. We're kind of going through what that means for him. He can't attend a mainstream school. The school that he does have is very therapy led. That goes through a lot of behavioral therapy, what's called ABA. We're currently going through speech therapy to get him to learn to speak off an iPad. So using buttons, and we're kind of using that to hear his voice. So that was almost coming up to 5 years ago now, and that was really my first exposure to someone close to me having autism. Fast forward 4 years, my eldest daughter Isabel, or Izzy as we call her, she'd always been going through life and through school with quite a severe dyslexia, and we were going through having that assessed for extra help with exams and things like that. And during that assessment, it became prevalent from the educational psychologist said, we're picking up some autism traits in Isabel that we'd like to explore more. It didn't come as a massive shock to us because we were starting to see some of those traits as well with the kind of the reading that we'd done around George and the education that we had. So Izzy is what we would consider as more high functioning autistic. She shows in a lot of different ways, many of which Mathieu kind of touched on a little bit around kind of missing social cues, what people might think is kind of social awkwardness or kind of bluntness maybe in a lot of her communication, and not kind of understanding how certain things, certain responses to questions make others feel. She also has a massive creative side. She's developing into being an amazing artist. The sketches she does is amazing, and we're still learning as a family how best we can support both George and Izzy through the different sides of the spectrum. It's funny that they both are considered on the same kind of spectrum, but they have completely different paths, completely different ways how they deal with it. And we're just trying to educate ourselves more and work out how we can support them both.
That's great. And I love how you both kind of are coming at this with the two different kind of perspectives. And, Mathieu, you talked about you have the difficulty recognizing the faces. I feel like I have the opposites. Like I can remember your face, but I can't remember like how I know you or your name or what we've done together. But I know you, but I don't know what I know you from. My mom had some issues, or still has some issues. She had some issues with dyslexia, or she has dyslexia, but she had some issues with school. Growing up, she didn't get to finish because way back when, because she's a lot older, obviously, they didn't know how to understand that. And even when we went to doctor's appointments, she couldn't read, because school didn't know how to handle that. And Anthony, as you were talking about how the school even recognized Izzy, right? Difficulties that she was having, they called that out for you. And I know that my mom, she has talked about how they didn't, they just were saying that she was like a troublemaker. And so she still has issues reading. And when I was younger, I had to help her when we went to doctor's appointments and stuff with reading things and filling out paperwork. And because no one even was there to help her. So I'm sure you guys probably, it's a little bit different now, but Mathieu, when you were growing up, did you have some of those difficulties, or was it a little bit better?
Well, I think I'm fortunate that I was academically okay. But actually recently I was going through my school reports. Sadly, I got rid of the primary school ones, I think, because I couldn't find them, but I still had the secondary school ones. And I mean, it was so obvious that there was something going on, but that's just, it was all put down to lack of interest, lack of effort. It was never good enough. It was like, not working hard enough. But yet, when I actually look at the average, the marks, I was actually on average or slightly above or slightly less, on average, if you just balanced out the marks, it was extremely inconsistent. So I think based on various factors. Maybe it could have been the teacher that I didn't like. I'm very sensitive to personalities, so if I find that someone has, if someone is actually not genuine or has some sort of a weird control vibe, I'm just going to react very strongly to that. And I think I could be very defiant in certain ways. And maybe if the topic, it's very hard for me to get interested in something if I don't see the purpose. So maybe depending on the actual, topics addressed in a certain semester, maybe I just couldn't get interested and my grades would be very low. And then, and then maybe I got interested or somehow I pushed myself to, I don't want to say work harder because I remember actually not always working. I just had a very different approach to homework. I think I'm fortunate enough that I was not labeled when I was young, because back in the 80s, I think the impact of a diagnosis would have been quite disabling, as in, keeping you away from opportunities, because specialized education, was seen as inferior and so on.
So different,
yeah, but
now.
yes, but I think things have changed greatly as well in terms of the attitude and the reception that parents may have towards diagnosis and labels.
Yeah, especially from what Anthony, you've said on just what George and Izzy are going through. It just sounds like, tremendously different from like when we were growing up.
Absolutely. Yeah. Sorry, if I can, just comment on that. I mean, if you think about Izzy's journey of being very early identified as dyslexic, which back in the old days, right, wouldn't have been a thing. They would have just been, cast off as troublemakers, or not very bright, and sat in the corner, not literally, but I hope not literally anyway. Yeah. And then from now, for that being identified very quickly, and then as a result of that, getting the diagnosis of during her educational psychology evaluation of autism as well, which now has her teachers have a better understanding of how she works, how she ticks, how she can engage in some certain things better than others. And kind of tying back to that theme of healthcare, it's if you think of healthcare, the healthcare setting in the schools, we would typically think of a school nurse, or to help with bumps and grazes or things like that. And now we're seeing that certainly what I'm seeing is a shift now towards educational psychology, mindfulness at school. Which is a massive shift from where we were 20 years ago. Now, I'm not saying that there's not further to go, but to compare my children and what they're going through compared to what someone like Mathieu went through 20 years ago, or longer, shall we say. I think we've made such headway in how that works through that school healthcare system, and how that stuff is tracked and monitored now, rather than just kind of discarded.
Yeah, definitely. So how do you see the progressions of the autism diagnosis and treatment over time? And would you say that the awareness of autism has grown, and what we have seen because of that has heightened awareness? I think we talked about it a little bit because, of just how like education, and even, I've worked in healthcare before I joined Cerner 6 years ago, I worked in healthcare for 14 years, from paper charts to when it went to HR. And I even think that it's changed. but I would love to hear from what you guys, and then I can throw some tidbits from my thoughts on when I worked in healthcare. So
Yeah, I can start with that. Yeah, so there's this really interesting book by Steve Silberman called Neurotribes, which basically it tells the history of autism research intertwined with the history of psychiatry, of child psychiatry, really. And it's a 500 pager, so I'm really going to summarize very much. But basically, there's Leo Kanner's initial definition of autism, which was extremely narrow. And that took place in the US. So that was the US branch. And it considered autism to be extremely rare and a very profound disability. So it was basically looking at non-speaking children, usually boys. And so a lot of people were actually kind of were assessed but excluded because they were, seen as not being sufficiently autistic. On the other hand, there was also Asperger's that was in Austria before Nazi Germany, and that there was actually a lot of buzzing research in Vienna in the 30s on what eventually led to the Asperger's diagnosis, which would be more like so-called high-functioning autistic children. And again, it was largely focusing on boys. So when you look back at the research that was done at the time, it was always boys. Somehow it was just really missing girls. And so basically it was a very psychiatric view from a clinician's perspective, and gradually parents started getting involved because they were feeling like they were not really being heard. They were basically be spoken down from clinicians, but yet parents were looking after their children, right? Yeah. And also, I think a lot of parents were being frustrated because their kids were being excluded because they were not considered autistic enough.
Especially the girls. I mean,
exactly. There's actually the story of Daryl Hannah, the actress Daryl Hannah, who was diagnosed as a child. It's a really interesting story that fits into this, story where she was, I think, in the 70s, and her mom was actually really a great advocate for her because she was being told certain things by clinicians, and she really stood up for her daughter to make sure her daughter would not end up in an institution. And there you go, what became of Daryl Hannah, which I think really goes to show. So basically, after the parents kind of started stepping in, and then eventually autistics themselves started speaking out, because what happened is when parents started leading the movement, this is actually when ABA, applied behavior analysis, started. But this actually, now it's the main therapy used, but it actually has a bit of a dark history, because it was the creator of this therapy theory is also pretty much led to a gay conversion therapy, because initially it was actually it could be quite violent, because he thought that he was actually curing autistic children by making them behave a certain way, but basically they were just training kids on a punishment reward system. And I think there was a big emphasis on punishment, and that included electroshock. I mean, there's a really dark history, to the point that to this day, if you say the word ABA, a lot of autistic adults just have a nearly traumatic, reaction to this. So I understand it's changed a lot, and I think things have really moved on from the 70s, in the original theory of ABA. But it just goes to show that, the understanding keeps evolving. And, we went from a very much, behaviorist approach, that we could see children behave a certain way, and there was no understanding of why they would behave this way. We just wanted to change how they behave, because we didn't think the way they behaved, we thought there was something wrong. And instead of actually, trying to understand why children react the way they do, we were trying not to make them behave the way they did. And we've moved on greatly from that. So yes.
Yeah. So I know from the reading and research that we've done around George, even inside the autism kind of online community, there's still a lot of stigmas around ABA, which from that dark past, which we've kind of read up on as well. George goes through ABA. We're seeing benefits from it, but it's a very different beast to the ABA that was happening back in the 70s and 80s around that.
I would hope
but
so.
Absolutely. But you're right. There is still a real stigma around ABA, around I'd call it controversy around people because it uses like a reward system. People relate it to like training a dog, or and you hear things like that all the time. Of course, there's a lot more science to it than that. And just to kind of piggyback on what Mathieu was saying, it's not about retraining what we believe should be societal norms of how a person should behave. It's more for the from what we've seen on the kind of with George at the moment he needs a certain kind of structure in order to progress with his own learning, and he needs that therapy in order to learn that. Otherwise he won't progress with his speech, with learning to use the iPad, with dealing with his sensory behaviors. So yeah, it's definitely come a long way, the ABA, and I know in Europe it's not as prevalent as it is in the US. It's quite big here in the Middle East, and we're certainly seeing results from it.
Yeah, I think one thing that you're hitting on is that being autistic is not, universal. Like each autistic person is different, has very different needs in terms of support. I've managed to get by without any formal support. I've just kind of created my own support systems, whereas some children may be non-speaking, may really need this kind of special support to get to learn, how to be more independent, how to communicate. So there can't be, a one approach, well, this is what autism is, because autism comes usually with a lot of comorbidities. And for example, being non-speaking is actually one of them. Like 30% of autistic people are non-speaking, but, being autistic doesn't mean that you can't speak or can't communicate. It just means that some actually happen not to speak, and this is just something that needs to be taken into account. And I think this is also very often there's this conflict within the autistic community that some people, such as I, can be not everyone, but sometimes I do encounter this attitude where, oh well, you were never diagnosed as a child, so what are you talking about? And to kind of, they just think that to be autistic you need to be severely disabled, non-speaking and so on. And when I see someone who's autistic and severely disabled by being autistic or by their comorbidities, I see someone with a lot of comorbidities and severely disabled, but I don't think that it's all down to being autistic. You can just break it down, and the new diagnostic approach with the DSM-5 is about that. It's really about defining, okay, what is being autistic, and not just throwing in being autistic characteristics such as being non-speaking, because to me they are two different things that may co-occur.
100%. And I really hate seeing that. I mean, some people haven't evolved and they still think that it's just that one thing. It's very frustrating when you see people that haven't evolved that way of thinking, especially
I think
when you see people in healthcare, and it's like, I feel like you should be evolving.
Yeah, it's definitely getting better. The healthcare is one area. Another one is teachers. We still do run into issues with some teachers if I think about Izzy's journey at school, most teachers are very accommodating and very understanding, but there is still some way to go in that area, and some teachers who see her as a disruption and a distraction to how they want to teach rather than, incorporating them into their learning style. Yeah,
I agree. What are some of the barriers you think to healthcare?
I can start with that. So in my experience, that's my experience as someone who And I like the parallel, for example, with the LGBT identity, because there's this thing of passing as neurotypical, which is my case. Like, people may not realize that I'm atypical until they actually interact with me quite a bit. And even at that, I'd say lots of people might get a nod vibe from me, but may actually not be able to, to actually articulate or to identify that I'm autistic. There's all the sensory issues and the social avoidance aspect of things, especially so, for example, sensory issues. Something that really struck me at some stage when I was thinking about it is the dentist. I find going to the dentist really challenging. I'm always extremely stressed when I'm on the dentist chair and I'm being proceeded on. And I was thinking back that I think when I was still living with my parents, the last time I went to the dentist was, my mom had made an appointment and I had gone. And then a few years later, I went my own way and became a student and so on. And I think it was about 10 years until I actually went back to the dentist, because I actually remember being at the dentist and he couldn't find any information. And he was like, well, when was the last time you ever saw a dentist? And I remember telling him, oh, it was 10 years. I was actually embarrassed that it had been 10 years, but it's just a kind of, and it easily goes unnoticed, because naturally, if you don't turn up to any sort of medical checkup, no one knows but you if you think about it. And then the whole environment can be quite challenging, like phone calls. I always kind of avoid making phone calls. So, I mean, my general physician, now I suppose I'm more used to it, so I do call them if I need, but there's just this general kind of avoidance, that I only going to make an appointment if I need. So that's kind of an invisible barrier, I'd say, that people may not be aware, that the actual way to engage with healthcare may not be very accommodating to autistic people, and then the environment may be very challenging sensorily. Like waiting rooms can actually be draining, and my sensitivities are not even that debilitating, I would say. I'm not likely to have I don't have meltdowns very often, and usually I'm more of a shutdown person. So if I go into an environment that's sensorily overwhelming, I'm just going to shut down and get extremely tired. And it's something I've become more aware over time. So now I just kind of protect myself. I wear headphones. I bring sunglasses. I don't care if people look at me funny, but I find it much easier to be in a waiting room and cope with the lighting if I'm kind of sheltering myself that way. So that's another kind of barrier.
I will say that I think that maybe, at least, I've perceived that I think that with COVID, that's helped some, I think maybe helped some things. Telehealth has gone up more. Making appointments, you can do those, at least some of the doctors. I can't do all of mine, at least online, but some of them I can do them online, because I also hate calling and making appointments. I don't know what it is, but I also hate calling and making appointments and talking to them. I have really bad anxiety and depression, but I get really bad anxiety when I have to call and talk to the doctor's office. But I feel like COVID has helped that. And also I liked when I had to go to the doctor and they let you stay in your car, and then they would call you, or text you and let you know that, hey, we're ready for you to come in. That was nice. Anthony, do you have anything to add about those barriers that they've seen or we've overcome?
I'm going to come at this from a completely different angle from the parent
I love
side.
that. I like this, that we have different angles.
For me, the biggest barrier for the treatment of my children is cost. And let me go into that from kind of the experience that I've had around kind of the autistic community. Obviously, my George, on the kind of the disabled and highly dependent side of the spectrum, he has a lot of therapy. That therapy is expensive. So if you think about his school outside therapies, he's probably having between 25 and 30 hours of therapy a week. That all comes at a cost. I'm very fortunate that I work for a company here in the Middle East where a majority of what he goes through is covered through insurance and through other benefits. I count my lucky stars every day. Not everyone who's in the same situation that I'm in has that benefit. So if I look at other families that I work with here in the Middle East, the cost for their therapies, all of those therapists are expensive. If you think about behavioral therapists, speech therapists, occupational therapists, neurologists that he sees, the teachers, the specialist teachers, it's the costs just keep going, and I'm fortunate that I'm in the position that I am. Now, I understand that in the US it's probably similar around kind of an insurance model, so there would be different outcomes there depending on if you've got a good job or not. Let's be honest.
Yeah.
If you think about the situation in places like the UK and Ireland and Australia, well, I think autism treatments there are a little bit behind, purely because they don't have that commercial element to them. They're funded off that public system, and I think this is an area of healthcare which is direly underfunded. I've got a friend of ours who has an autistic child in the UK, and we're comparing our situation to hers, going through either trying to use the public system or even trying to find private resources because they do have the ability to pay. And the support networks and the funding for it just isn't there. So I see that as the biggest barrier for autism treatment for young kids today.
I definitely agree. And even when I worked in healthcare, I used to also work in a neurologist office, and I would sit on calls to do like prior auths for some of the testing that we would have to do. That was, I don't understand why we have to get authorization for tests that are so required for things that are needed for healthcare, for patients, for all types of, diagnoses for things, but especially for when, kids that are coming in that are growing and developing that need these things, that are, adults too, but it was so frustrating. For me, being in especially neurology, and you see these parents that don't have good insurance, and you have to fight for days and weeks with insurance companies that don't even have, sometimes, they're just like, no, I'm like, I have to get my doctor. I'm like, I think I was on a call and I'm like, what's your doctorate degree? My doctor here is telling you they have to have it.
And I have good insurance, and I still have to have those fights. And now, and this is an interesting kind of parallel as well, because I work in revenue cycles, so I know the system. I know the system better than most people, and yet I struggle to navigate it as well. So it's I can only imagine what it would be like in that neurologist office having those conversations. I think I'd get pretty heated as well.
I had lots of heated conversations. Well, I hope that is a barrier that continues to grow and get better as well.
Actually, while on the topic of diagnosis and insurance, for adults in Ireland, as far as I know, pretty much getting a diagnosis would be on me. The current insurance system with private insurance, they basically give you something like €25 per appointment. So an assessment may only be 4 appointments, but it's like €1,000. So you just get €100 back. I actually made inquiries because I don't have a formal assessment, and I was curious to see, okay, what would be the financial implication. So it pretty much kind of excludes. I'm fortunate that I have a job, I have private insurance, but if this is what it costs me with a private insurance, and knowing that the public system, you can be referred to by your GP, but there's very long waiting lists, and you're prioritized based on mental health crisis. If basically, I think realistically, if you're not suicidal, you could be on a waiting list for an assessment via the public system for a very long time. And people might think, well, someone who's an adult who's never been assessed before, they may actually not, be disabled enough to require diagnosis, but a diagnosis may be required for receiving accommodation through work. I mean, there's also lots of comorbidities, such as digestive issues. I mean, there's actually a lot of physiological comorbidities that come with autism that may be completely missed because they could seem really somehow unrelated in isolation. So, I mean, a diagnosis should actually be it's a really important part of someone's medical file, and yet it's so hard to get as an adult. It's pretty much like a luxury. It depends on someone's willingness to spend some money on it, knowing that the support available as well once you get the diagnosis as an adult. And I mean, bouncing back on what Anthony was saying earlier, you may get a lot of support for children, but once you're not a child anymore, a lot of that support goes away, even though you're still as autistic as you were as when you were a child. And this is kind of a really, really big issue. And another thing that in terms of safety of the patient, I think it's important to remember is not only the physiological comorbidities, but depression and anxiety are just like really common amongst autistic people, especially the undiagnosed. A lot of women are actually misdiagnosed with depression, anxiety, any disorder, you name it, bipolar, personality disorder, borderline, but turns out that they're autistic, and some eventually get properly diagnosed with autism, but it can be quite a fight. And I think every day online we find a story about someone, very often a woman, who finally got her autism diagnosis after years of trying to convince physicians who kept saying to them, oh, you can't be autistic because you're a woman. They just go through the official criteria, and they're not really able to join the dots. And another thing I think that's really striking is also increasingly anorexia is being linked as an expression of autism somehow, that the impact of mental health. And it's something, again, I mean, you can try to treat someone with anorexia, but if you don't realize that they're autistic and this is what needs to be acknowledged, explored, you're probably never going to be able to address the anorexia until you actually address the autism. And one piece of data I find, it's quite sad, but it just says everything. A piece of research that found about suicide, that in the UK, although around 1 to 2% of people are autistic, up to 15% hospitalized after attempting suicide have a diagnosis of autism. So if you actually consider that a lot of autistic people are not diagnosed formally, I think it just speaks really miles.
Yeah, definitely. And you made a good point about how the children and then the adults, and it's not like it's the cold and it just goes away. It's definitely you're still autistic, or it's still there. It still needs to be discussed, and you still need to be diagnosed and approached by healthcare, and not just be like, oh, well, it wasn't looked at when you were a child, or whatever, like you said earlier, of, you weren't officially diagnosed when you were little, so you couldn't be, or you're a female.
You've got this far, you can't be that bad. But it's not. I mean, it's really not the case, right? It's something that
maybe I managed, but I still need help.
That's managed and endured rather than treated. Yeah.
Exactly.
It completely invalidates. Yeah, it completely invalidates people's stories and challenges. Yeah.
Exactly. So how do you think this may impact the culture of a company like Cerner, and what might be the positive impact on healthcare?
I'll go with that very quickly. So I was talking about neurotribes earlier, and in that book, it actually starts from kind of a realization that a lot of the parents of kids diagnosed with autism, there was a spike in the early 2000s of autism diagnosis, because all of a sudden clinicians were just suppose they had better abilities to identify autism. And interestingly, it kind of also fed into the anti-vax movement, because all of a sudden so many kids were autistic that they linked it to a certain vaccine that was going around at the time. I can't remember which. So
I've heard lots of that when I worked in family practice.
yeah, and so the author was kind of looking at a lot of things around this phenomenon that happened in the early 2000s, and he realized that a lot of the parents of the kids that were being diagnosed, they worked in engineering, IT, or medicine, and which is really, really interesting. And actually, I'll just do a little shout out to the ADI, the Autistic Doctors International, which was created by an Irish anesthesiologist fairly recently, to kind of raise awareness that a lot of physicians are autistic, because it turns out that like clinical skills are usually very relevant to autistic people. There's just a lot of attention to detail, a lot of, I think there's a lot of purpose, drive as well, and so on. So I think as a company that works at the intersection between IT and medicine, this information is very relevant to us. There may be a lot of autistic people working for Cerner, a lot of people who may not know they're autistic, a lot of people who may know they're autistic, but it's just not something they're comfortable sharing. This is actually something also that the ADI has found, that there's a lot of autistic physicians who they're just afraid to disclose because of the stigma.
Yeah.
So I think we're in a very, very good position to talk about autism, to talk, where people can say, well, I'm autistic, and I have a career, and I don't actually meet the expected stereotype of someone who just can't work and can't manage their life, even though it is more difficult to make it through hiring process very often, because we're largely going to depend on the interviewers and how, I suppose, on their own bias. So like my personal approach is, maybe because I'm in my 40s and I'm just getting to the point where I'm not really that caught on what people might think of me anymore, but my approach is just to be open about it, because I think this might lead people to say, well, actually it's okay to say you're autistic. It's just part of one's identity. It does not necessarily mean that it's a burden. But my vision is that I hope that increasingly leaders can come out, and when they're autistic, and come out and say, and be comfortable enough to say, oh well, I'm autistic, and that's okay, because I think that can really drive acceptance and start conversations. It's not really that there's a strategy and we can foresee what's going to happen, but I think openness leads to openness and to more acceptance once people can actually see examples of someone achieving something, and incidentally, well, they're autistic.
I agree. Let's break those barriers down.
Yeah, and I mean, it leans into a lot of things that's been happening around kind of not just Cerner, but most companies, thankfully these days, around just having a diverse workplace. With diversity is barriers are coming down around kind of in all different areas around race, religion, sex, sexual identity, all that type of stuff. And I think I see this as just another area of where the more diverse of a work culture you can have, because autistics will see situations differently. They'll be able to bring they can bring more of those traits into the business world and as a way to thrive. And I think it's really interesting, like Mathieu said, with being at that intersection of healthcare and technology that we always say, it does give kind of an opportunity for that. For the statistics show that autistics lean towards those types of careers and career paths. So yeah, I think it's good. It is good to see those barriers come down. I still, like we touched on earlier, there's still a long way to go. I think the stigmas are getting better. And they are being removed. But like I was talking about with a certain population of teachers, there's a certain population of everyone who, still, through not through kind of any malicious, is probably just still a little bit naive to kind of autism. And that's why, Autism Awareness Month, which we're currently in, is still needed and still relevant. And yeah, I mean, what that means for my own kids, I don't know. I have a lot of hope that we are in a different world to we were when Mathieu was going through education and finding jobs and things. With my oldest daughter, it's funny because that kind of healthcare realm, I do see a very caring nature in her, with beside the kind of social cues and bluntness that she has, but she also does gravitate to her younger brother in a way that I think she's got a different relationship to him than I do. And my neurotypical daughter, they kind of, she has a very caring nature. So it's going to be interesting. She's only 12 now, so it's going to be interesting to see how she evolves down that route. So yeah, I'll keep you posted.
Yeah, definitely do keep us posted. I definitely think the more that we talk about it and bring it to, the more conversations and more of the, normal life of just this is not something that needs to be afraid to talk about, and more, away from that stigma, it will become, we'll get closer to making it just more of that okayness, which it should be okay. Like it's not something to be afraid to talk about or to be, to hide that you have. We need to, have those things like in interviews and in healthcare. Like, what do we need to do? Like, go to talking to like patients or our healthcare providers or teachers and classrooms, like, do we need to change education? Do we need to change the way we're teaching our providers and nurses and stuff to make sure that we're including all of that? How are we building our products to make sure that it is including those things? That's what we need to continue to bring into our discussions, I think. Thank you guys so much for taking the time to talk with us today, to share your experiences and the importance of this topic. I think that it is important for us to learn and understand and make sure that we're thinking about all this and keeping it on the forefront. I would like to ask you both one more question to end for our listeners. What are some ways that associates in various roles can get involved, or do any calls to actions or keep at the forefront?
Well, actually, recently I got together with a few neurodivergent associates and we created a group, a Yammer group in community called Neurodiversity at Cerner. And we did that because we thought there needed to be a space where people felt comfortable talking about neurodivergence, of any neurotype involved. So that's actually one way of connecting with neurodivergent associates or allies, people who just also want to increase acceptance. The other thing I would say is, just don't be afraid to be yourself and to there's a principle that I try to apply, which is, be neurodivergent without saying you're neurodivergent. So it kind of goes a bit like that. If I, for example, react to someone, to a situation where I think the person is not being really inclusive and say, well, I'm autistic, so chances are the person might be like, see me in a different way and make assumptions about what I can or cannot do. So I usually try to avoid saying that unless I know the person actually really understands what being autistic means. And I just try to explain and communicate what it is that I need and how can they be more inclusive to me. And I find that this usually works. It's kind of a bit of a mind gymnastics, because you need to figure out, okay, what exactly do they need to know, to provide me what I need. And I think it's something that it relates to accommodation, and you can go and ask for accommodation and call them accommodations, and people might think that you have additional or special needs. But the reality is that everyone should be accommodated to what their need, to what they need. We all have different needs, so
100%.
accommodation is something quite universal. It's about communicating what you think the person should provide you, whatever that might be. If it's that someone is actually never really giving you clear instructions, well, just find it in you to articulate this and to communicate to the person that you need clear instructions. So that would be kind of my advice to someone who wants maybe to gradually improve the culture within their reach.
I agree. Anthony, any closing thoughts?
Just for me, I'm still kind of learning on this journey. As a parent of a a child with special needs, it's an emotional journey. It's physically and emotionally draining, and so any support and any learning that I can get, I thrive off, and I'm thankful to Mathieu and his kind of initiative to kind of start up this neurodiversity yammers and SharePoints here at Cerner, because I'm learning a lot, and it also lets me kind of like, just this session for me has been very therapeutic. You may not even know it, just to kind of talk in this kind of open setting about it. And so just to piggyback on what Matthew's saying is about not shying away from the topics, talking about them. I'd also encourage any parents of neurodiverse children to kind of join up to that group as well, because it's becoming a really good community with a lot of kind of understanding and education for myself. So yeah.
I agree, and I'll share the links. Thanks again to both of you, and thanks again everyone for joining us today and for being a part of the podcast with me over the past year. It has been an amazing journey and pleasure talking with everyone to share information on how we can connect in many ways to bring patient safety front and center. So thank you and have a wonderful day.